examination of your head and your face. You just get to sit there comfortably, and I'm going to just start by making some observations. I'm going to be looking at your hairline, noticing anything that's kind of off to me, but everything looks good. I'm going to look and note any thickness or abnormal thinness of the hair. I'm going to look at your skin. I'm going to be checking for any skin conditions. I'm going to be looking for any bruising or swelling, anything like that. Everything looks really good. I'm going to look at your relation of your head on your neck and shoulders, which I'm looking for any signs of torticollis, which everything looks good. Next, I'm going to stand behind you. I'm going to look through your hair to see if there's anything abnormal through your skin, of your scalp. So I'm just going to start by lightly going through the hair, checking the scalp line. I'm looking for any sort of rash, any types of cysts, or if in a younger patient, any kind of nits or lice. Everything looks good. Now I'm going to just gently press on your scalp and let me know if you feel any discomfort with this. Anything?
Nope.
Alright, and then next I'm going to just move forward a little bit and palpate the parotid glands, which are just above the angle of the jaw. Looking for any lumps, anything like that. Everything feels good. So now I'll have you turn around. The next thing we're going to do is I'm going to just percuss on your sinuses a little bit, your frontal and maxillary. Just let me know if you have any pain or discomfort with this, okay?
Nope.
No pain? Alright. Any sort of pain would be indicative of sinusitis. But everything is good here. So the next thing I'm going to do is I'm going to listen to two of your arteries, the temporal and the orbital artery. So I'm going to start with the temporal, and I'm going to use the bell of my stethoscope. And I'm going to look for any types of bruise, any whooshing noises. Okay, so check both sides here. Everything sounds good. Now I'm going to have you close your eyes, and I'm going to be checking the arteries, your orbital arteries. So you're going to feel a little bit of pressure, but it won't hurt, okay? You're going to feel it at the bottom and roll up. Both eyes. Good. Alright. The last portion of our exam, we're going to be testing some cranial nerves, starting with cranial nerve 5. We're going to begin just by testing the sensory component. I'm going to take my fingertips and run them across 3 spaces on your face, and I want you just to tell me if you feel any differences, okay?
Nope, they feel the same.
Same? Good. Alright, the next part of the cranial nerve 5 exam is going to require, well, I'm going to be using a wooden stick. And I'm going to have you open your mouth and press or bite down on this. It can just feel light pressure, and I'm just going to try and pull it out of your mouth, okay? So open up, bite down. Good. Other side. Very good. Alright. One more test for cranial nerve 5. And I will be using a Q-tip, and it's the fabric is pulled out. And it's going to just feel, or I'm going to be touching your sclera of your eye with this, just the white of your eye, and it's just going to feel like there's a little hair in there, and you're just going to want to blink. Okay? So, open your eye for me. Good. Other side. Very good. That concludes cranial nerve 5. Next, we're going to be testing cranial nerve 7, the motor portion, which is very simple. I'm just going to have you raise your eyebrows for me, all the way up. Alright, and then I'm going to have you smile. and do the best frown you can do. Alright. Alright, and then I'll just have you puff your cheeks out for me. Very good. And that concludes the head and face exam.